Hi guys. Um, just wanted to put out a good question that patients constantly ask me. One of which is what to use, whether to use ice or heat. Excuse me. Ice or heat. Very excuse me. So basically, rule of thumb for using ice would be if we have an acute injury, if it's under 72 hours, a new injury, haven't experienced it before, we would put it 2 to 3 times a day for about 10 to 15 minutes. If the area is less meaty, as in the neck, I'd put it on for about 10 minutes. Somewhere where there's a bit more soft tissue, like lower back, glutes, legs, you can put it on for 15 minutes. And some people will put ice on every hour for 15 minutes. I think it's a bit excessive, but I guess if you've got nothing else better to do, you're at home, then you can do that. Otherwise, working within your functional means of doing it maybe before and after work, 2, 3 times a day, that works alongside any recommendations of your practitioner or your doctor. When it comes to heat, used, from my personal opinion, for more chronic injuries, something that you've had longer than 6 weeks, which is subacute period, but and then chronic period is 12 weeks, but 6 to 12 week period, you'd go on to the heat again, 10 to 15 minutes in the same affected areas. And then something else that I recommend generally with patients in office is adaptability and patient tolerance. What do I mean by that? If I've recommended them ice and they've had an adverse reaction to it, then I just tell them either to go to try the heat or don't do anything. So some rules you can't adhere to if the patient compliance and tolerance is not there. So rather than making the patient worse, then, as I mentioned, do nothing or try the opposite. And then lastly, I've got a group of patients that I guess enjoy the best of both worlds and are eager and conscientious, and really the patient compliance is just really sort of on point. In which case, then you can try doing heat, then ice, then finishing off with heat. So again, 10 to 15 for the heat, 10, 15 for ice, 10 to 15 for the heat. Finish with the heat. So that creates a conduction convection effect, just a flushing of the blood flow and the byproducts. So yeah, guys, I thought I'd keep it simple, and basically what to do when you've got a chronic injury, heat, acute injury, ice, or a mismatch between the two of doing. If you can't tolerate the ice, then do the heat. If you like doing a bit of both, then that's fine as well. But I just thought I'd give the gold standard protocols first. Thank you for watching, and see you in the next video.